I think there's a lot that individuals can do to address healthcare disparities. I think the first thing is understanding how we practice and how the way in which we practice may potentially propagate those disparities. As an example, I'm a nephrologist, and we serve patients who are disproportionately Black, disproportionately Hispanic, and disproportionately poor. How are our clinics set up? Our clinics are set up to be Monday through Friday operations typically. Do we provide specialty care for people who may need that kind of specialty care but are dependent upon working Monday through Friday? Can we set up clinics that might be open on a Saturday or evening hours that may provide more access to care so that someone doesn't have to take time away from work when if he or she isn't working, he or she's leaving money on the table? So I think thinking about the ways in which we practice that may make our care more accessible to more people, I think is one way. Secondly, thinking about going into the communities and going to where the patients are rather than being totally dependent upon their coming to us. And so I think about novel ways in which we can deliver care through care partners or through partnerships with primary care practices where we know the patients are, but maybe we as specialists go to the primary care practices and partner with them so the care is more accessible. Thirdly, making sure that we are educated ourselves about our own individual biases. I'm a nephrologist. I practice dialysis primarily, and we know that our patients who are poor, who are from racial and ethnic minorities, and who are from other marginalized communities, when they reach end-stage kidney disease, are less likely to be referred for kidney transplantation, and they're less likely to be offered home dialysis. And one has to wonder how much are our individual biases inadvertently causing these disparities in care. So I think making sure that we're thinking about and understanding our own potential biases is one way in which we can overcome them. We can't overcome them if we don't acknowledge that they may exist and therefore think proactively to make sure that every patient who comes through that door who has advanced kidney disease is offered a referral for kidney transplantation automatically, to take that bias out of the equation. So those are some examples of ways in which I think we as individual clinicians in that individual encounter with a patient can try to overcome some of the disparities by taking care of where they are, making sure that we try to check our own individual biases.